Thank you so much, Allison. Can you guys hear me? Oh, great. Good
Yes, we can.
afternoon, everybody. Good. I'm Dr. Branch, and I'm so pleased to welcome each and every one of you to this symposium on maternal child health. Now, I can't be with you for the whole time today. I have to defend the Department of Health and Human Services budget to council today. So I'm going to get off the line with you guys, and then I'll be jumping on with the council and stuff like that. But I am excited that we have received more than 150 registrations for this event. Why am I excited about that? Because each of you represent linkages to maternal and child clients that you may not know about all the different programs that we have. So I think we can certainly benefit from offering you that information and then you sharing with us your information. Now, keeping you up to date and informed, we can improve the health and well-being and the overall outcomes for women, children, and families across our county. And you know, too many times I have to say to you that I read about a disturbing fatality report of an infant. And that fatality report is many times preventable. It's kind of like a common theme. The child was born premature. The past child spent some time of the first month of his life in the hospital, and the child may have been thought to be able to have some developmental delays or something like that. But we made sure that there was an appropriate functioning and available crib in the house. And despite that, the child was placed in an unsafe location, many times in the bed with their parents in between the two of them. So this happens one too many times. And while the death of one child is related to circumstances, it's just far too many. And I'm sad to say that in just the first quarter of this year, we already had more infant deaths than we've seen in the entire year of last year. So available programs and services we offer could have made a difference, a major difference in the outcomes at so many stages along this tragic conclusion. So, and that kind of can begin with the assistance to the family planning and education even before conception. So I just want to thank each and every one of you for being here today. There's so much work to be done, and having all of you as partners will help produce the desired positive outcomes. Um, our Department of Health team members have planned a lot for you today, and I don't want to stand in the way of all that, so I want you guys to get started. So I think it's my job now that I'm supposed to be able to pass the baton over to Teresa Fath, who will share a bit more with you and what you can expect. But again, I thank each and every one for your presence, and I always say, when you come to any type of symposium or conference, take at least one thing away that you will make a difference in the way you are practicing your craft, because that difference will make a difference between the lives of the people that we serve, because it could be a matter of life and death. So God bless you all, and thank you for attending this symposium for maternal and child health services. Thanks a lot. Bye-bye.
Thank you so much, Dr. Branch. And as he kindly handed off the baton, my name is Teresa Pfaff. I am a public health nurse supervisor here at the Baltimore County Department of Health, and we'll be getting you going now. So just a quick couple of things on housekeeping before we launch, and that is that the chat is up and running. We also have a question and answer box. So if you could take a moment to locate your chat options as well as the Q&A box, and you can put any questions that you have throughout the meeting. We also have our wonderful team of panelists here who will be presenting and also helping to assist. So I'm going to have a shout out, and Tia Brown is going to be assisting with the chat. So if anybody needs any additional services there, she's there monitoring it and will let us know. But during the majority of the presentation, we will have all participants muted and do Q&A at the end. So with that, I believe that we are going to hand off for a moment of mindfulness to JC.
Good afternoon, everyone. I am Josephine Carindel Garcia, or JC Garcia for short, from the Department of Health and Human Services as a Quality Improvement Administrator. Part of my role is assisting all our programs in conferences and trainings. Today, we call this a Symposium for Maternal Child Health Resource and Information Sharing. Symposium originated from a Greek word used in reference to drinking together after a meal. I am sure we have shared many meals of conversation. What we are offering today is in collaboration with each other, drinking together by taking in the different resources we are sharing for the common purpose of improved health and better birth outcomes among the women and children in our communities. Knowing that this is a big task and may add to the already overwhelming responsibility we carry in serving our clients, our Department of Health and Human Services intentionally takes some time in our learning activities and in some meetings to create presence practice. Our hope is for each one of us to put ourselves fully present for each other this 1 hour and 30 minutes. As some of you may be familiar with this mindfulness and presence practice process, if it helps you to close your eyes as you listen to my voice, please do so. I invite you to take in slowly, good, calming, and energizing breath. And breathe out all the unnecessary distraction you may have carried with you. Breathe in and out, trusting that given the space of grace, every concern we have that do not belong to this 1.5 time will work out in its proper space and time. Continue to breathe in and out, breathing in and holding for 1, 2, 3, 4, 5, 6, 7, and breathe out slowly at the same pace. Breathe in and out, feeling the grounding of your chair supporting your body, relaxing every part of your body that needs that extra care. Your neck, your shoulder, your arms, your body, down to your legs, allowing that breath of calm and good energy to fill you. As you continue to breathe in and out, take that breath of good collaborative energy and creating that good space to listen to what we each have to offer, giving power to your gift of attention and care. In this space, we will drop our urge to multitask so that we can fully hear each other well, and in that space be able to make good choices and silence your phones. As we open our eyes and return to be fully present with each other, I will ask that you open your chat page and write how this presence practice experience was for you. As a reminder, one of the dangers we face in our multitasking world is that we often carry one burden of a phone call or a meeting to another meeting space, removing our capacity to be fully present. We hope as we all intentionally create this presence practice in our every work and personal space, we can return ourselves to how we want to be with and for each other. Also, as Teresa has mentioned, there is a question and answer section that you will find on that 3 dots after the chat page to put in your questions as the presenters are giving you their expert knowledge on the areas that they are giving. Thank you. And now let me turn the presentation to the panelists. Is this for Antia or Allison?
Thank you, JC. That was wonderful and a lot of positive feedback in the chat. So thank you so much. And we are going to turn over to our first presenter, Antia Brown, who is the program supervisor of our Administrative Care Coordination Unit. Also, we love to use acronyms, so ACCU. So take it away, Antia.
Good afternoon, everyone. Like Allison said, I'm Antia. I'm the program supervisor of the ACCU, Administrative Care Coordination Unit. We're the link between Medicaid recipients, MCOs, managed care organizations, and healthcare providers. We serve the Medicaid population and those eligible for Medicaid. We receive a variety of referrals from the state, from hospitals, and OB offices. Primarily, the referral that we receive is the Maryland Prenatal Risk Assessments. Those are the MPRAs, and those come from our OB offices. The highest population we serve are those women who are pregnant and in need for prenatal resources and are eligible or have Medicaid. We help those as well who need access to appropriate medical care, those who may need assistance with finding providers via their MCO, those who need connection with beneficiaries to services, especially specialty care, assistance with billing issues. We also help explain appeal and grievance rights and help them access and navigate the health choice system. Thank you.
Wonderful. And then we are going to turn it back over to Teresa Faft, who is a nursing supervisor, to talk with us today about prenatal programs or perinatal programs. I apologize.
Thanks, Allison. So our perinatal programs really encompass the full spectrum that we wrap around for pregnant and parenting individuals. So when we say that, we have programs that provide care coordination, case management, nurse case management, and home visiting services. So the programs do range from pregnancy to 6 to 12 weeks postpartum, depending on the program requirements. And the populations served include are listed here. We have our pregnant postpartum individuals, infants with medical, family, social, environmental, or developmental concerns. So you can see this really encompasses the broad range of needs in the community. And we really, really encourage everyone to refer and utilize these services. So when we're talking about what type of perinatal program services that we have in-person and virtual visits that provide educational information and guidance during the pregnancy period and also after delivery. We have health assessments through our nurse case management programs that do ongoing child health and physical assessments with the pregnant individual. And we also offer up a lot of anticipatory guidance and resources for health and wellness, a lot of information on child safety, and we offer the care coordination and navigation, which is probably one of our biggest components that we see is how that you can actually wade through a lot of the services, referrals, any type of linkages and care coordination that you might need for an individual. So we really want to assist in helping find that that link. And now we would like to actually share with you a moment we're hearing from a program participant.
Really happy to speak on my experience because it truly was life-changing for me. I was introduced to the program when I had my first son, and he was a premature baby. He came a month and a half early. My first child, so everything was new to me, and I was seeking guidance that I was hoping to get from the doctor's office. I was just hoping to get from my family. But what this program did was provide that for me and Nurse Lisa. She was like an encyclopedia of knowledge. Everything that I came up with, asked her, or tried to Google, she also had the answer for, and she put it in a perspective that made me understand and also just have another advocate on my side. She was so instrumental to the confidence that I developed as a new mother, and understanding and being proud of the transition that I was exploring into. She provided me with endless knowledge that I am able to use today, that I continue to speak to other new moms that my friends are now, mothers, just people that are looking for some type of support. I always speak to the fact that I had someone on my side within this program that really taught me how to be a mom, and I'm better for it. I have another child, and when they presented an opportunity for me to get into the program again, I immediately said, I'd like Nurse Lisa, and she was available because she was just that impactful. So I'm grateful for this experience. Something else that I took away from it was like the confidence that we spoke about, but also advocating for myself. When I was in the doctor's office, having my questions ready, so I can go in feeling knowledgeable and come out knowing what they told me was accurate, but then also that I better understood the type of diagnosis or type of medicine that I was being recommended. She also taught me to always get my blood pressure number, which as an African-American woman, that is really huge in our community, preeclampsia, high blood pressure. And to some doctors, things are normal, but when you are pregnant, that can run a risk of being dangerous for the mom and the baby. So just overflow of knowledge. It's going to be that resource that you can always lean on, that will be able to guide you through your process and use as a sounding board for any of those off the wall questions as new moms have, and even moms that have other children. You never stop learning. As you see, all children are different. So being able to have an experience like this was very, very impactful for me. I mean, I love Nurse Lisa so much. A funny story. I wanted to send her flowers, but I wanted to do it discreetly. And I was looking at her email address and the salutations where they put, her office building. So I had flowers sent to the main Department of Health building, but she doesn't work there. Luckily, I was able to get her phone number, and they were able to deliver her flowers. But those were the things that were important to me, because the endless appreciation for her is overwhelming for me. But I want to just let her know how thankful and how appreciative I am, because it's made me a better woman. It's made me a better person. And I encourage anyone who has an opportunity to get this type of help, that they definitely tap into it. COVID taught us a lot of certain programs that were out there for us to assist us during hardship. And this is something that was really instrumental. So again, thank you so much for having this program. Thank you so much for nurses like Nurse Lisa, who are truly passionate in what they offer and what they provide, and are making a difference for the people that they do impact. So I highly recommend this program. I highly recommend Nurse Lisa, and I wish people continue to get the support that they need, because it will change your life.
So that was our two-time participant, Miss Letitia Carter, and we were really, really grateful that she was able to give us that time and recording. So thank you for the claps. That's wonderful. So then The next thing that we have been hearing about, and you can see in the chat that there's been some questions already popping up about how to refer to our programs. And here's a great opportunity. We actually have streamlined the referral process within Baltimore County Department of Health. And there is one referral program for all, referral form for all of our programs. And you can complete the referral form with as much information as available to you and email it to our standard shared email inbox that is monitored. And it's the maternal child health at baltimorecountymd.gov. We really like to have that very long ending. And you can, if you also can fax it as well. Now, we have the referral form that once we get as much information from whoever is referring, it could be a self-referral, can be a healthcare provider, community participant, a friend. We review and the form is triaged using our team through one of our programs, and the most appropriate program then will get the referral and complete within 2 business days that handoff, so that we can get the referral in the hands of the team so they can start calling out and making contact with those clients. So our main phone line, I want to highlight this, is the 410-887-0249. That is going to be the best phone line to reach the entire division at. And again, we're really trying to focus on having one central point. So our email, our phone number, and that one referral form. And that is the fastest way to get a response from us. Now, I am going to share just briefly a couple of images. These are images that are taken showing what you can expect from the referral form after we share this with you in PDF. It's a fillable PDF form. And these are the fields that we're hoping that you would be able to provide some additional information so we can really get it to the right team and the right program. And yes, the participant does need to live in Baltimore County. That is the main requirement. There are some other programs that you'll hear from later that have specific criteria, but the general thing to remember is that we will work diligently to make sure that clients are connected to the appropriate program based on their specific situation. So please do not hesitate to reach out. Any questions are great questions for us. So there's one image. And then I have another one that kind of shows some of the risk factors. Now, these are not all encompassing, which is why we have a small other notes comment, but these are some of the things that we have seen recently in our community and in the needs of our population. So these are the 2 images that just we wanted to share with you in anticipation of hopefully getting these referrals.
Thanks, Teresa. And that the referral form was shared in the resources section of this symposium. So, or if you were unable to access, reach out to the email line and we can send it to you directly. All right, let's do next slide. So you've heard a lot about, what we are able to offer to the Baltimore County residents and families, but I wanted to we kind of wanted to close up talking about our perinatal programs of how we measure outcomes, how we measure success, how we measure and look at poor outcomes for these families in Baltimore County. So I wanted to talk a little bit about fetal and infant mortality review. We call it FEMOR for short. And this is a team that's an action-oriented team and that goes through a quality improvement process. So they're continually assessing, monitoring, and working to improve these service systems and community resources for the target populations we've talked about today. Our FEMOR team is made up of all different kinds of partners that work really well together. So healthcare professional county agencies, community-based organizations where they confidentially review real cases of stillbirths and infant deaths in Baltimore County. So we really focus on the social, economic, and health risk factors that have contributed to those deaths and really focused on identifying gaps in the services and systems. So that's broader than just the services and programs that we've talked about today. It's how can we improve services in Baltimore County across the board to improve these birth outcomes, which we're all working together to do today and onward. So then the team makes, by reviewing these case reviews, we make recommendations um, for these improvement of service systems and community resources. And then that drives the community action team. And the community action team is also part of FEMER, and they really work to prevent infant mortality, improve these outcomes for young children and for mothers in Baltimore County. Teresa, next slide. We wanted to do a pitch since we have all the providers or many providers on this call today. You are invited. If this is something that you would like to learn more about, if you would like to contribute in a meaningful way to the team, and then also to take information back to your partners and the group that you work with. If you are interested in joining our FEMER team, what you're committing to, just to kind of give, I want all the information on the table. We do meet quarterly, and it's about a 2-hour meeting. You would attend to provide your perspective from where you're coming from, what you see in your field. You would also work to collaborate with the team members, which include, you know, again, healthcare providers, community partners, agency representatives. We work really well together, and we respect the difference. It is not a finger pointing. We are really just looking at how can we prevent the next one. And so we you'll also participate in helping assist in the development and implementation of evidence-based policies, practices, and programs. And then we do ask that you share the recommendations that we have learned from the case reviews back to your teams, as well as any partners that you may have. So Teresa, next slide. And then I will say that the team members often do report that the information, the data shared, we looked at data quarterly of what's causing deaths and poor pregnancy outcomes. At each of our meetings. So we're always talking about data, and team members have reported that it is helpful and does make an impact on their practice and process. And so if you are interested in joining, we can always use more providers, community partners. You know, we're in this good fight together. So here's my contact information. I certainly can drop that in the chat box as well. So if you are interested, please reach out, and I will give you a little bit more of an orientation and answer any questions you may have. So, and then with that, we are going to pass it off to back to, I think, Teresa, the next slide is the contact information. We'll pause. Oh, nope, we jump right into childhood-led poisoning and environmental case management. And we have the program supervisors, also a nursing supervisor, Colleen Hess, to talk with us about that.
Thanks, Allison. Good afternoon, everyone. My name is Colleen Hess. I'm the public health nurse supervisor for Baltimore County's childhood lead poisoning and asthma environmental case management program. Our program is grant funded through the Maryland Department of Health, the Maryland Department of the Environment, and the Maryland Childhood Medicaid program. And our goal is to improve the health of children by providing in-home support that focuses on the reduction and or the elimination of lead in the home, asthma triggers in the home, and any other environmental hazards we may come across in the home. The lead poisoning prevention program and an asthma case management program, it's voluntary. It's for families with children under the age of 18 who have been diagnosed with moderate to severe asthma or have an elevated blood lead level and who meet income guidelines. The only eligibility requirements are that the family resides in Baltimore County and they're under the age of 18 and that they are enrolled in Medicaid or CHIP or eligible for Medicaid CHIP. We provide 1 to 6 home visits to a family that enrolls to assess for potential sources of lead and or asthma triggers in the home. We provide a lot of education for families, such as elimination of lead sources, the elimination of asthma triggers. We go over green cleaning tips for the home. We go over nutrition, and we make sure every child has an asthma action plan filled out by their pediatrician. We review asthma medications, and we make sure all the kids are using their inhalers properly with a spacer. And we work with the primary care providers to create that asthma action plan for every child so they have one at home and at school. We monitor children with elevated lead levels to make sure they're getting follow-up lead tests at designated intervals. And every family that enrolls gets free durable equipment. It includes a HEPA vacuum filter, HEPA vacuum, a mattress and pillow protectors, green cleaning kits, mattress and pillow protectors for the beds, and integrated pest management that is necessary. Thank you.
Wonderful. So then, Teresa, next slide. And we are going to hear from one of our audiologists, Hillary.
Hi, everyone. My name is Hillary Spanier. I'm one of the audiologists with Baltimore County Department of Health. I work over on the west side of the county in Randallstown. There's also another audiologist who works over on the east side of the county at Rosedale. What we do is we assess the hearing system. We serve residents of Baltimore County, and there's two reasons, like with the newborn hearing screening. If the newborn did not receive their initial newborn hearing screening, can definitely come to us and we can test them, like say they had a home birth at a birthing center for whatever reason, wasn't tested before they were discharged from the hospital. And also for a high risk rescreen, such as a NICU stay for more than 5 days would require a rescreen around that 9 month of age. We accept Medicaid, and for those who are non-Medicaid recipients, it's a fee based on a sliding scale off of income. And the link over here is a really good resource page. It's to the Maryland Department of Health. It gives a description of 2 of the different types of newborn hearing screenings, as well as different fact sheets about the screenings, what it means if your child passed, did not pass, and certain milestones to look out for as they get older.
Wonderful. Thanks, Hillary. And now, Teresa, next slide. Oh, actually, here's that slide I was talking about. I mean, we're going to pause here if everybody wants to jot down the phone numbers that have been shared, the fax line, as well as the email address. We'll give you just 30 seconds or so. Either sometimes I take a photo on my phone, that's helpful to refer to it.
And Antia's already put it in the chat as well. So you can also copy and paste and grab it out of there.
Wonderful. All right, then let's move on. We are moving into our conversation on behavioral health, and we have 2 presenters today that are going to flex back and forth. We have Sherry Ann Little and Heather Dewey. So I'm going to go ahead and turn it over to them.
Thank you. Hi, everyone. I want to point out that we are in May, which is Mental Health Awareness Month, and we can't talk health and not talk mental and behavioral health. So yes, my name is Sherry Ann Little. I'm a social worker with the Bureau of Behavioral Health, also known as the Local Behavioral Health Authority, which is a combination of the Core Service Agency and the Local Addictions Authority. The Core Service Agency is going to focus on the mental health components, whereas the Local Addictions Authority focuses on the addiction behavioral health services. But together, our role is to implement or oversee rather, the public behavioral health system and to implement the state level behavioral health work on the local level. Every jurisdiction in Maryland has a local behavioral health authority or a LBHA. Just every jurisdiction may have it comprised of both a CSA and an LLA, or it may just have like a CSA. So we're here in Baltimore County. We, again, our LBHA is comprised of the CSA and the LLA. Next slide.
So hi again, everyone. My name is Heather Dewey. I work with Sherry Ann Little on the behavioral health team at the Bureau of Behavioral Health. So a little bit about what we do. Again, every jurisdiction in Maryland has some version of a local behavioral health authority. And so across Maryland, our job as a local behavioral health authority is to collaborate, advocate, strengthen, and then ensure access. So collaborating, we're working with system partners to improve access to behavioral health care. So again, that's mental health and substance use services, primarily for folks with medical assistance, so Medicaid or Medicare, though we do help with navigation of grant-funded services. We'll get into a little bit more about that later. So we actually sit on the FEMR, the Fetal Infant Mortality Review meeting, the Child Fatality Review, or the CFR. We have lots of community resource meetings. You may have seen Sherry Ann Little at some of our, I think you're at the Southeast Network meeting. So we're out and about making sure folks are aware of what is available and helping to partner, because we know things change, staff change, resources change, and we want to make sure that we are partnering with everyone to make sure there's good access to care. We also advocate. So we advocate for policies to advance prevention, early intervention, treatment, and recovery as it relates to behavioral health. So many of you may know Baltimore County has a behavioral health advisory council that actually will advise the county executive on different legislation that should be supported or different actions that can be put in place. And that's for behavioral health across the lifespan. So from infant all the way up through aging, advocating for policies to help support needs in that area. We also want to strengthen our community by supporting behavioral health and wellness. So as we'll get in later, there's many grant funded things that we put in place so that folks, regardless of insurance, can access care. That includes everything from crisis services to even some community outreach campaigns. And we want to ensure access to a full range of quality behavioral health services. Again, you may hear us refer to the public behavioral health system, or some people call that PBHS. So we're primarily focused on folks who have Medicaid or Medicare, but all residents of Baltimore County, we want to make sure have access to a full quality range of services. And so that's where some of our grant services may come into play. Next slide.
So we're going to talk more about the actual services that our department provides. So first up, within our mental health services, or our core service agency, we have provider relations and compliance. So if you're working with a client or a patient and they're having difficulty or challenges at their outpatient behavioral health center and they don't know who do I contact to report a complaint or to talk about the challenges or the barriers that I'm experiencing, then you're going to want to direct them to our provider and relations compliance team, and then they'll investigate and be able to streamline solutions within the our department and our team, but then also with the providers that are all part of the public behavioral health system. Next slide. So talk a little bit more about the second unit on the mental health team. It's our adult services team. So part of the oversight that we provide is clinical review and authorization of care. So that can be for residential rehabilitation, psychiatric crisis beds, bed holes, supportive employment. So we're available to answer questions about any of those resources, or how do you access what are your options in the local neighborhood of your patients or your clients. We also want to highlight that we have the adult county flex funds. We have a little asterisk there for two reasons. One, the first reason is just getting the word out that if you are working with a client or provider that has a mental health diagnosis, or their dual diagnosis, mental health and substance use disorder, they need or diagnosis, they have medical assistance, they're engaged in care, and they've run into like a tough time financially, they have access to a one-time consumer support fund of up to about $1,000. For eviction prevention, security deposit if they've been homeless and now they're or experiencing homelessness and now they're trying to settle into stable housing. So there are funds that most people don't know or exist or we have within the Bureau of Behavioral Health. But then the other asterisk is if your client or your patient is working with the Department of Social Services, they have their own funds. So they would be the go-to for that family first. Next slide.
And so another area of our local behavioral health authority is our child, adolescent, and young adult team. So folks may hear us call that KAYA, or that language may be floating around there again, because everybody loves a good acronym. So if you hear KAYA, it's child, adolescent, and young adult. So similar to our adult team, we also have flex funds available. And again, the reason our team offers this, some people may say, why is there money available for things like eviction prevention? It's about behavioral health. Well, it's hard to focus on your behavioral health if you're worried about being housed, right? It's hard for a child to worry about going to therapy if they're worried about whether or not the electricity is on, because they worry about those things too. So similar to the adult team, if a child has medical assistance, we have some flexibility around that as an outpatient treatment. And there are some needs like eviction or emergency turn off, security deposit. There's also up to $1,000 per year, per fiscal year, per family that can be accessed. Something we have that is a little different though, that we really like in Baltimore County, and throw this out there, not every jurisdiction in Maryland has this, so we're kind of awesome for this, is we also have funding available for pro-social activities. So that means for our kids who have a mental health diagnosis, they're in outpatient treatment, we can fund things that can help support their wellness, up to $500 per child per fiscal year. So for some kids, that may look like summer camp. That may be equine therapy that is not currently covered by medical assistance. There is a provider in Baltimore County who has a short term that they can do for $500. It could be an educational class, like a cooking class or a poetry class or something at CCBC that can support wellness. There's a lot of creativity that can be used in those funds, all to support behavioral health and wellness of our kids. And again, if they're doing well, that's more time that the adults that you're working with, those parents and those caregivers, can have their ability to focus on what they need to maybe get done for something else because their kids are taken care of. We also grant fund in-home intervention services. So that's a supplement for a child who's in outpatient care who may need some more support in the home. So if you're seeing caregivers that are really stressed because we just can't figure out what's going on, our child is having some struggles, they're in outpatient, it's not enough, in-home intervention can come alongside any family regardless of insurance. So if you have medical assistance or if you have commercial insurance, there may be a copay for commercial insurance, but we grant fund the difference to be able to make sure there's that supplemental service to support youth and families. And then we also oversee connections to other services like residential treatment centers and transition age youth. Sherry mentioned earlier, these are all mostly an administrative role we take, so processing the applications for a community provider who may actually be providing the care, but we help make those linkages and smooth out the system because we can be in that every day while we know other folks may only be in that here and there. Next slide, please. We also have a mental health team in our detention center. And so that team in the Baltimore County Detention Center provides individual and group therapy, peer support, as well as linkage and referral to services post-release. We thought this is important for folks to know about because a lot of folks don't realize that our agency oversees those services, but you may be working with somebody who has just been released from Baltimore County Detention Center or maybe was there for a period of time, and being able to request those records or be able to know that they did have access to treatment or could have access to treatment is really important. If someone's bringing up legal concerns and they're worried they may be detained, making sure they know they can still access treatment in that setting is really important. And something that's great about the linkage and the referral to post-release services is they can follow an individual up to 1 year post-release. So that's just an extra support in the community to help resolve a social need that you may be experiencing that could be creating a barrier to care. Perhaps somebody is not able to come and see you because they're worried about connecting with these other services and transitioning back in. These services through the Baltimore County Department of Health can help support that person so that you can focus on what you need to related to the maternal child health needs. Next slide. And then this is just a good image about, you heard me reference the public behavioral health system. So for folks who have medical assistance, so Medicaid or Medicare, these are the different services that are either grant funded or available through their insurance in Baltimore County and really anywhere in Maryland. And we kind of listed in a pyramid based on how many people may be accessing. So our bottom, our Our floor of that pyramid is core services that really anyone in Baltimore County can access, and they're grant funded. So we're going to talk about Baltimore County Crisis Response and our Behavioral Health Helpline and our Reach Warm Line in a moment, so I'm not going to get into that now. But those are 3 services that any resident of Baltimore County, regardless of insurance status, regardless of documentation, they can reach out to those services and get supports. And then as more and more support may be needed, folks can move up the pyramid. So whether that's outpatient mental health or adding, some people have heard the term PRP, psychiatric rehabilitation services, all the way up to the tip of the pyramid. Again, the tip of the pyramid, the fewest people are accessing because it's the most high intensity need, but it's still a need, and that's inpatient psychiatric. So while we are not a provider of all of these levels of care, we work as a system administrator, so we oversee those providers. And Sherry Ann mentioned if there's a complaint, you can call us. You can call us about these providers, and we can help navigate those things. And then again, we try to fill the gaps, like that foot of that pyramid is grant funded services that we fill the gap for. So we're managing the system. We wanted you guys to be able to see this because these are resources that the individuals you're working with can access. And not everybody always gets to see the whole menu. Here's the menu that folks can access for mental health. Next slide.
Yep. We just want to spend some time talking about the harm reduction services that are available for all Baltimore County residents. Through our LAA, we have the harm reduction team, and they provide community outreach. They provide training, naloxone training, also the provision of naloxone medication. So for case managers or community health workers, if you haven't had training for how to properly administer naloxone, it's great to reach out to our team to be able to sign up for their virtual trainings. Not only do they do virtual trainings, but they also offer where they'll come to any place within the community, or they'll also offer agency and organization trainings as well. And again, that will, after you complete training, you also receive the medication itself. So I always like to push that because everyone who's properly trained and equipped and ready to help out in the community is a plus for us all. But they also provide syringe services as well as safe drop-off or disposals, wound care, and also fentanyl test strips, so individuals are able to safely test when they're actively using. And again, they provide outreach in the community, so just reach out and request. Next slide.
And just to piggyback on Sharon, I can't speak more highly about our harm reduction program. They are available. So I know we had, just sharing a story, we in a small group that I'm in church, somebody knew somebody who had passed away from an overdose, and they were able to get together and give us a nice naloxone and train us, to train me, to be able to train them on how to access naloxone, and everyone carries it. So that's something you could bring to your offices, your teams, all of that. So
Excellent.
yeah, you're great. So just moving on.
Getting a little Heather, really quickly before you jump on, there is a question in the chat and it has to do with the pyramid that you just talked about. So before we move too far, Teresa, can you back up to the pyramid? The question is on the continuum of care. Can you give a quick example of number 9, therapeutic behavioral programs?
So therapeutic behavioral services, or TBS, is an actual service line. So it's a specific program that can be piggybacked onto services for youth specifically who are already in outpatient mental health treatment. So for instance, a youth may be at ABC Outpatient Services. I'm making up a name. If that is a provider, I don't actually know that. So you're at ABC Outpatient Mental Health. And let's say they're doing services and they just need more. They need something else that's in the community, in the home, to supplement outpatient, to generalize what they're learning in outpatient. They have 2 options. First, they could add PRP, that's number 6, psychiatric rehabilitation programs, which they will work with youth in the community. It's more on that socialization. It's all time limited, generalizing those things. But then the next level up from that is TBS, or therapeutic behavioral services. So often, but not always, providers who provide services will provide both psychiatric rehabilitation and therapeutic behavioral services. So they provide both levels of care. And TBS can come on and they'll provide a certain number of hours in the home to work on what the outpatient goals are in the home and community. So supporting the caregiver and generally around youth needs related to their mental health diagnosis. So for instance, if a child has a diagnosis of ADHD and we're having trouble with attention, a TBS provider may be working in the home with the caregiver on behavior management techniques. So you learn something in outpatient and then that provider can go and work in the home and community on implementing those in the live environment. So that's an example. We have a list of PRP providers the Baltimore County Department of Health maintains. We don't have a separate one for TBS or therapeutic behavioral services providers, but again, most psychiatric rehabilitation providers are therapeutic behavioral service providers. So I can get that list to our team to maybe add to the webpage, our outreach lists as well. We are going to tell you guys a phone number that you can call shortly, though, if you have questions or want to link up to these services. So have your phones ready to take some pictures.
I'm going to take a little moment just to highlight that sort of what Heather talked about earlier, how we have services within the detention center for mental health. We also have for substance use disorder treatment. So they have certified peer recovery specialists or access to them. There's individual and group therapy. Again, we just want to highlight that this exists to help promote the continuity of care, right? Because the goal of the team that's at the detention center is to provide linkage and screening and referrals to reduce recidivism. So our goal is to just let you know that the programs are there, they exist, and be able to facilitate communication when necessary. Next slide. Oop. So last but not least, within talking about the services, so the team also provides screening and referrals for pretty much all of the Baltimore County agencies. So if your client is working with DSS, parole and probation, and they need to be screened, this is the team that they're going to refer them to for referral to additional services. We like to also highlight that there is a program within Baltimore County Health Department and it's really for just screening and assessment only for high intensity residential treatment for pregnant women who need substance use disorder treatment, residential care. But again, this team also does education in the community. They also do screening and referrals from or of adolescents that are cared or referred to by the Baltimore County Public School System. And again, they also offer naloxone training and supplies. Next slide.
And so just want to talk a little bit about our recovery-oriented service of care. So folks may hear this referred to as ROSC, so another acronym for you guys, ROSC. So our recovery-oriented service of care continuum for substance use has certified peer recovery specialists that provide support, mentorship, linkages to services, and again, you'll see naloxone training and actual naloxone medication. So we can't speak more highly of the peers that we have in our bureau. So peers are individuals with lived experience. So they have gone through struggles with addiction. They've entered into recovery, they're doing well, and they're then able to come alongside other folks who are maybe new in recovery or considering recovery, or maybe not even there yet and just need some resources, as well as their loved ones, their family members, to provide support and care. They teach us new things all the time, and they are a great resource. That's not an experience I've had. So if I'm having a conversation with someone who wants to know about treatment or what to do for a loved one, their perspective is key. So we have a whole department that is able to have these certified peer recovery specialists that can actually support these conversations and step into those conversations where it may be hard to fill the gap and help make those linkages. Next slide. And then again, this is just a picture of our public behavioral health system for substance use disorder. So while we are integrated, you'll hear Sherry Ann and I say behavioral health, which is mental health and substance use together. We do have two pyramids because the systems run parallel to each other. So, the state is working on it. But here is a picture of the substance use disorder levels of care that are available for folks who have Medicaid and Medicare. So again, our base is the same, and those are 3 numbers we're going to talk about momentarily. But as you move through treatment, folks may be in the screening programs we talked about, or early intervention, to outpatient, to then we have partial hospitalization, intensive outpatient, and even residential treatment for substance use. So again, most people are in that larger part of the pyramid. That's where services are happening, but we do have people who have a higher intensity need. You can kind of walk up the pyramid based on what your service needs are. We oversee the providers of those levels of care in Baltimore County. Again, our provider relations is available if someone has questions or concerns, and we will get into how to access those in a moment with those numbers. Next slide, please. And now we're going to talk about how to get into it. Next slide. Thank you. So the first number we want to make sure, if you have a phone, this is when you can take it out. I'm saying go ahead, take out your phone. Hopefully we're not already on Instagram and you guys, we still have your attention, but take a picture of the slide and please save this phone number in your phone. So Baltimore County does have the Baltimore County Crisis Response System. So we receive federal and state funds, but we also in our jurisdiction are special in that we locally fund services to make sure there is a full array of crisis response systems available for any Baltimore County resident or person experiencing a behavioral health crisis in Baltimore County at the time of the crisis, regardless of their insurance status, regardless of their documentation. These services are available, our crisis operations and hotline 24/7, 365 days a year, and you can access them 2 ways. So first, some of you may have heard about 988. We're going to talk a little bit more about that separately, but 988 is a 3-digit phone number that you can call. There's some challenges with how that links up that we'll get into when we get in the later slide, but the direct access line, so you guys can save this number, is 410-931-2214. So if folks call that number directly, you will directly get into Baltimore County Crisis Response and be able to access the full array of services. So again, our hotline will actually screen folks on the line. You can be the person in the crisis. You may be calling about someone. One of the good things in Baltimore County is for over 20 years, we've had a co-responder model where we have specially trained police officers that if they are needed, can respond in the same car with a clinician to intervene if there is a significant lethality risk. So this is not our normal patrol officers. These are specially trained officers that are placed at the same place as our clinicians. They have their own place that they all stay. And because we have that, we can do things like well checks if we aren't hearing from somebody. We can go out and do those responses. But the rest of our services are not police involved. We have an in-home intervention team, which is 2 mental health clinicians that can go out and work with someone. An urgent care clinic, so lifespan, so child and adult can get you in within 24 to 48 hours to see a mental health clinician as well as a psychiatrist. If you are about to run out of medications and you can't get a doctor appointment right away and you forgot, you can get into these bridge services to help avoid having to go to emergency department or help avoid having to go and see someone else. The urgent care clinic we also want to put out, we know folks have often talked about there's a long wait sometimes to get in to see a doctor. So you can make an appointment with a regular community-based provider and then go to the urgent care clinic to cover the gap in between. So if you know your appointment is not going to be for 2 months and you don't think you can wait, or your client does not think that they can wait, like, you know, it's really bad. I don't need to go to the emergency department, but it's bad. I need to see someone. Make that appointment for 2 months, but then call the urgent care clinic and fill the gap. You don't have to wait here in Baltimore County. You can be able to see someone who can prescribe. Again, we mentioned our mobile crisis team, but our Baltimore County Crisis Response also does community education and events. So if you guys are interested in having them come out to talk about their services, if you have resource fairs, you guys can reach out and they can come and do presentations as well. Next slide.
So for the sake of time, because we actually have a couple of videos that we want to show, so I'm just going to say, please go ahead, take out your phones, take a picture of this, and then later on, just save the number in your phone. It is our helpline number, so this is where you're able to access our entire team, or mine and Heather's entire team, for any questions you might have about the public behavioral health services, or just behavioral health services, or outpatient providers, anything within and programs within Baltimore County. So it's a great first stop to be able to just touch base with us to find out what's available.
Next slide. And this is our Reach Worm line. We talked about peers. So if someone has a question specifically about substance use, you can call 410-88-REACH, REACH, to connect with our peers. Take a picture of the slide as well. Again, great resource to be able to connect specifically with questions about substance use. Next slide.
Another great resource to have, it's coordinated entry if you are working with a client or a patient that is at risk of homelessness or are experiencing homelessness. This is the telephone number you will want to share with them. It will provide access to all of the homeless services, prevention services that we have, as well as like rapid rehousing, shelter placements, even being able to reach out and to assess like what shelter may be appropriate for your patient if they need like wheelchair access. It's a great number to have and a resource to use. Next slide. Me. So I'm going to make it really quick. So again, 988, much like how calling 911 gives you access to emergency services, calling 988 will give you access to behavioral health and suicide related crisis related services. So great number to utilize. The hiccup, or rather not the hiccup, but the challenge with using the 988 number at this time, if you're working with a client who relocated from New York, just let them know that when they pick up that phone to call 988, the number that they're going to register, what they use is that telephone number that they're using, the area code for it. So they're actually going to reroute them back to New York as opposed to local services here in Maryland. So anyone that has like an out-of-state number, you're going to share with them to advocate for themselves that they're trying to connect to Maryland services. Literally, it will take an act of Congress to be able to have that sort of access to individuals to ping from the nearest call tower to be able to access them. So just let them know, advocate for themselves for Maryland services. Yep, another great one. Anyone who can text or chat and they need to be connected to a crisis counselor, they can through 988, as well as they can web chat. Let your clients or patients know it's a free, confidential, and secure way to access, again, crisis counselors and also resources. Next slide.
So this is some resources for physicians. So while we know some of you are physicians, not all of you are working with people who are engaging with physicians. And so this is information everyone should be aware of to share. The first thing we're going to show a short clip about MACS, the Maryland Addiction Consultation Services. MACS provides supports to prescribers and their practices, pharmacists, and healthcare teams to address the needs of patients with substance use disorders and chronic pain management. This can includes consultation education, and something we want to make sure you're aware of going into this video is there is something called MACS for Moms. So they actually provide and support for maternal health providers addressing the needs of their pregnant and postpartum patients that have substance use disorders. So you don't have to be the expert in substance use disorder resources and needs. You can call MACS. So if we can shoot over and play this video real quick, please.
Treatment for opioid use disorder is an evidence-based intervention which can help save lives. The data is clear. There are not enough providers available to treat the number of patients with opioid use disorder.
The Maryland Addiction Consultation Service, also known as MACS, was created 2 years ago with the goal of providing support to individual practitioners in an effort to expand the use of medication-based therapies for opioid use disorders throughout the state of Maryland. I believe that having the ability to call the line has given providers a clinical support system that has enhanced their confidence in caring for individuals with substance use disorders.
The Maryland Addiction Consultation Service provides support to prescribers and their practices in addressing the needs of their patients with substance use disorders and chronic pain management. All services are free, including the phone consultation for clinical questions, education and training opportunities, assistance with addiction and behavioral health resources and referrals, technical assistance to practices implementing or expanding office-based addiction treatment services, and the Max Tele-Echo clinics.
Max provides free phone consultation to any prescriber in Maryland for clinical questions related to substance use disorder treatment and chronic pain management. Available Monday through Friday from 9 a.m. to 5 p.m. Prescribers can call Max to request individualized resources and referrals, customized to fit the needs of their patients.
Max offers a variety of education and training opportunities related to substance use disorders and chronic pain management. We provide trainings on understanding the provider's role in the treatment of opioid use disorder, waiver trainings, and prescribers' next steps after obtaining their waiver. We also offer a variety of webinars. Many of our trainings offer free CME and CEU credit.
Max provides free individualized technical assistance and capacity building to prescribers and their practices across Maryland. Our team of expert addiction consultants support organizations as they implement, expand, and improve their office-based addiction treatment services. Max provides a broad range of approaches through a blend of on-site and web-based services such as practice readiness evaluation, billing policies and procedures, implementation of medication for office-based addiction treatment, and workflow development.
Project ECHO, Extension for Community Healthcare Outcomes, is a collaborative model of medical education that improves access to specialty care by linking expert specialist teams with prescribers and their practices through real-time online learning sessions. Max Tele-Echo Clinic connects a team of specialists with prescribers and their practices in their communities to provide didactic presentations and case-based learning.
To request any of our services or for more information, call us at 1-855-337-6227. Available Monday through Friday from 9 a.m. to 5 p.m. You can also visit our website at www.marylandmax.org and connect with us on social media.
Thank you. So we hope that that's a resource that can be helpful. We're going to go to the next slide, please. We also know that 64% of people nationally who attempt suicide visited their doctor within the month prior to their attempt. So there's just such an opportunity for a lot of you guys who are in the primary care field or working with primary care providers to make sure they have resources about suicide prevention in primary care fields. So there's actually a website at the bottom of this slide. We will put that in the chat as well, and I do believe a PDF of these may be available. That actually is a toolkit that is specific for primary care providers. And that toolkit provides information about risk management and reduction, screening and assessment, as well as training. So really want to make sure that these resources are available in the community with our primary care physicians. Everyone can be screened for suicide risk, adult or child, in a primary care setting. And again, you can call Baltimore County Crisis Response if you don't have the resources there to intervene. There are things available in Baltimore County to support. Next slide, please. And then one more resource we're going to have a short video clip for that we would like you guys to check out. And this is BHIP, or the Maryland Behavioral Health Integration in Pediatric Primary Care. So while we're here talking about caregivers, talking about folks who may be pregnant or postpartum, that means at some point there's a child that's coming along, or they may have other kids that are available. And those stressors that caregivers experience in trying to manage the needs, the behavioral health needs of children, are unique and can be challenging. And they come up in primary care settings because it affects us, right? So making sure primary care health providers have information about how to support those caregivers is important. And there is another phone number that primary care providers can call for consultation and training. So we're going to show this short clip that you guys can get more information.
Before the COVID-19 pandemic, 1 in 5 children had a mental health disorder, yet only 20% received mental health treatment. During the past 2 years, we have seen a dramatic increase in mental health concerns among youth, including increased depression, anxiety, and suicide. Emergency departments have been overwhelmed with youth experiencing mental health crises. However, many of these children do not have access to necessary mental health treatment in their communities, leaving them and their families with little to no support. As a pediatric primary care provider, you are in a unique position to respond to this urgent need and address the mental health concerns of your patients. I am Dr. Maria Radowski-Stanko, Director of Child, Adolescent, and Young Adult Services at Maryland Department of Health, Behavioral Health Administration. I am calling on pediatric primary care providers across the state of Maryland to increase your efforts to identify and treat children's mental health. Together with Maryland Behavioral Health Integration in Pediatric Primary Care, BHIP, you can support children with mental health needs and provide them with the treatment they need to improve their quality of life and avoid mental health crises. Thank you for making a difference in the lives of children and families in Maryland.
BHIP provides free support to pediatric primary care providers in Maryland, including telephone consultation with child and adolescent psychiatrists, resource and referral networking, care coordination, telemental health services, and continuing education opportunities. We're also working to improve systems of care through social work co-location in primary care and supporting crisis care transitions. Call us at 855-MD-BHIP. That's 855-632-4477. And visit us online at www.mdbhip.org.
Thank you. And before I pass it over to my colleague to wrap us up, there was a question in the chat. It said, what about mental health services for Spanish-speaking clients that are undocumented? So I'll just be very honest. It's a challenge in our public behavioral health system, which is built to serve individuals with Medicaid and Medicare. If the person is a child, there are some resources, but it can be challenging for adults. If you call the Bureau of Behavioral Health helpline that we mentioned earlier, we do have a resource list available of providers who are multilingual in a variety of different languages, including Spanish, and many offer fee-for-service services to folks that can pay out of pocket at a sliding scale. Some offer some free services. But that is an area we're always also looking for resources ourselves to be able to support in the community. I'm going to pass it over to Sherry.
And it's just contact information. I'm also putting it in the chat so that way you quickly have our email address. Just email our shared group email for any inquiries. If you need a case consultation, it's just a great way to reach out to our team to help access and to gain knowledge of what's available in the public behavioral health system in Baltimore County.
And all the numbers that we shared, our helpline, our crisis response, our reach, this email can be shared with residents of Baltimore County. So the caregivers, young adults, children, they can call directly and ask for resources as well. So please feel free to share that information with your networks.
That's it. I believe it's now time, or handing it back to you, Allison.
Yeah, so I think JC is going to get us started on our question and answers session. We have, I believe, addressed every question that has been in the chat. So JC, do you want to get us started on that? Oh, you're muted, JC.
Were all the attendees able to find where the question and answer box is? It's at the three dots on the right
I will
of
say,
your chat
JC,
page.
I tried to put a question in there and it wouldn't
Doesn't work.
post. No, so I don't know
So
that.
we'll just keep the chat page then for questions. Okay.
And if you have any questions, please feel free to raise your hand. JC can go and unmute you and you can ask your question out loud as well. And I think the big burning question in the chat is about the slides. And JC has answered also in the chat, but just in case that is your question as well, we will be sharing a PDF version of the slides after the presentation and after you complete your survey. So as she's also mentioned about the survey, and we can talk about it at the end as well, but as soon as you X out of or leave this meeting, you will be promptly directed to the post webinar survey. If you could go ahead and complete that, and then we will send out the slides after the conclusion of that.
Okay. I
go ahead, Heather.
One of the questions I have, but this is more logistics. There are two Ericas in the registration, but there's only one Erica identified without a last name. In order for you to be properly credited, if you're a social worker, please identify yourself on this chat page. Otherwise, if you do not need the CEUs, we're fine. There was a question about RNs being able to receive CEUs. I consulted with our nursing panel, and they said that because this is not a clinical training, they really are not authorized to provide CEUs for this. Correct me if I'm wrong, our specialists of nurses.
Correct. And I did address that with the participant that did ask. I do see a question in the chat about our infant safe sleep initiatives in the county. And this has been a huge hot topic for Baltimore County. I know it has been with the city as well. And I don't know that we have enough time to talk about what all we are doing, but just really quickly to talk about what our maternal child health and perinatal programs have been doing. We have a standardized safe sleep education protocol. So all women and families, we're really focusing on expanding to caregivers, are receiving the same education at the same intervals, and we're repeating that education at every single visit. And that starts from where they're screened in ACCU all the way through with all their home visits and postpartum. We have been partnering with this city child fatality review team as well as our county child fatality review team. We review the cases. We are trying to share similar media campaigns with similar language, as well as we do have some durables available for families so we can distribute safe sleep sacks, safe sleep environments of a pack and play with sheets and all of that. So we are constantly talking about safe sleep, but really the big focus has been to expand caregiver education. So not just with mom, but if that's grandparents, if it's friends, if it's dad. We have not seen the same spike in the respiratory illness with our cases, but as the city has, but we are also talking to families about that just to try to give them as much information as possible. And I'm happy to follow up about safe sleep after the call if you want to send me an email. Hopefully you have it from the contact pages.
So another question is, what about RN care coordinators who work in the community and provide care coordination?
There is no CEUs offered for nurses for this meeting. With the information that we are sharing does not meet the criteria for a nurse CEU. I'm sorry. I would be a great contact for Safe Sleep, and I will put my contact in the chat one more time. I also, and we didn't talk about it today, but I also coordinate the child fatality review team. And so we, and several of the people on this call participate with that, but I would be a great initial contact, and then I can pass you around if we need extra information. Any other questions?
So I'm going to stop the recording now. I know we've gone over time and I want to just be respectful for all the different folks and what we've got. So I'm stopping our recording.